Neopression as brexpiprazole is a new hope for schizophrenia and major depressive disorder patients. FDA-approved indications: monotherapy treatment of schizophrenia and adjunctive therapy to antidepressants for treatment of major depressive disorder. Neopression, your safe gate to efficiently controlled state. How Neopression works. Neopression as a brexpiprazole acts as a potent partial agonist at dopamine D2 and D3 receptors. As it works as a dopamine antagonist in the mesolimbic dopamine pathway and works as a dopamine agonist in dopamine mesocortical pathway. A potent partial agonist at serotonin 5-HT1A receptor and a potent antagonist at 5-HT2A receptor. Norepinephrine alpha-1p and alpha-2c receptors. Also, it has moderate affinity for histamine H1 receptor. Neopression in the treatment of schizophrenia. According to a 6-week randomized double-blind and placebo-controlled trial published in American Journal of Psychiatry 2015. Neopression at dosages of 2 and 4 mg per day demonstrated statistically significant efficacy compared with placebo and good tolerability for patients with an acute schizophrenia exacerbation. Neopression appears to be very well-tolerated drug. The overall incidence of treatment, emergent adverse events, was lower in the Neopression groups than in placebo group. Recommended dosage for schizophrenia. Neopression as an adjunctive therapy to antidepressants for treatment of major depressive disorder. According to a 6-week randomized double-blind and placebo-controlled trial published in Journal of Clinical Psychiatry 2015, Neopression as adjunctive therapy demonstrated efficacy and was well tolerated in patients with major depressive disorder and inadequate response to antidepressant therapies. Neopression was well tolerated with few patients discontinuing due to treatment-emergent adverse events or reporting serious adverse events. Recommended dosage for major depressive disorder. Neopression appears to be well-tolerated drug, according to an article published in the International Journal of Clinical Practice 2015 about the differences and similarities among antipsychotics. Neopression is more tolerable in akathisia, as the number needed to harm for akathisia in schizophrenia in case of Neopression is 112 patients, in comparison with 25 patients in case of aripiprazole, 15 patients in case of cariprazine, 10 patients in case of lorazepam, and in major depressive disorder, 15 patients for Neopression versus 5 patients in case of aripiprazole. According to an article in The Lancet 2020 about the comparative effects of antipsychotics on metabolic functions, no evidence of statistically significant or clinically relevant adverse effects on metabolic measures and prolactin when compared with those for placebo. Metabolic side effects are a serious concern with some second-generation antipsychotics, namely clozapine, olanzapine, and quetiapine. Neopression at dosages of 2 and 4 mg per day demonstrated statistically significant efficacy compared with placebo and good tolerability for patients with an acute schizophrenia exacerbation. Neopression as adjunctive therapy demonstrated efficacy and was well tolerated in patients with major depressive disorder and inadequate response to antidepressant therapies. Neopression offers optimum efficacy with less side effect, especially akathisia in comparison with aripiprazole, cariprazine, and lorazepam. Neopression has the least metabolic adverse event in comparison with clozapine, olanzapine, and quetiapine. Neopression, your safe gate to efficiently controlled state by HSO marker.